Today, I will be discussing the dynamic and progressive role that school nurses play in suicide prevention. My goal is to show how school nurses demonstrate leadership, advocate for student mental health, and collaborate within the education system to cultivate an environment of safety and early intervention. What is a school nurse? School nurses go beyond their basic role of managing physical health concerns. They are often the primary healthcare provider that students see regularly. Their daily interaction with students puts them in a unique position to notice subtle behavioral or emotional changes that other school faculty might overlook. Over the last decade, school aged children's needs have evolved greatly, with mental health concerns escalating. Consequently, the role of the school nurse now includes monitoring mental health, providing crisis support, and connecting students with appropriate resources for mental health care. Their leadership helps encourage a climate where mental health is treated as an essential part of overall well being. Suicide risk factors and statistics. Most students who are at risk of suicidal ideation and completing suicide do not manifest the signs and symptoms clearly. Identifying who is at risk directs suicide prevention efforts. Genetics, family history, bullying, trauma, and social pressures can all influence a student's mental health. Students who identify as LGBTQ+ or who live in rural communities often face additional barriers and stressors. The statistics shown underscore why suicide prevention is paramount, as schools are typically the first place that symptoms start to emerge. Suicide risk factors and statistics. The ability to recognize the behavioral or verbal cues that students may give is what is most important in suicide prevention, rather than the statistics presented. Mood changes, withdrawal, or expressions of hopelessness are often the first warning signs of suicidal ideation. School nurses are trained to interpret these signs and determine whether a student needs more specialized mental health care. Their clinical background helps ensure that concerns are not overlooked or misinterpreted. How does the school nurse's role in suicide prevention demonstrate leadership? The school nurse's role in suicide prevention not only exhibits influence, but also demonstrates advocacy and proactive involvement. School nurses model leadership by acknowledging the gaps in mental health support and pushing for policies that prioritize student safety. They also act as bridges between students, families, and mental health resources. As trusted figures within the school system, school nurses may be relayed concerns or feelings by students that they would not share with others. This report enhances the nurse's effectiveness in leading the school community towards improved suicide prevention protocols. Interprofessional collaboration. Suicide prevention is a collective effort among all individuals and not one single person. Collaboration between school nurses, counselors, administrators, teachers, and district board members ensures that the needs of students are not neglected. However, research shows that when the school nurse's role is not clearly understood, teamwork can suffer. By establishing clear communication and defining responsibilities, collaboration becomes far more effective. Understanding the school nurse's expertise also promotes efficient interprofessional collaboration. Suicide prevention education and training matters. Education and crisis training are key factors in successful suicide prevention. Comprehensive crisis intervention or risk assessment training allows school nurses to be more equipped to identify warning signs and manage proper responses. Training also supports nurses in educating the rest of the school staff, which creates a more informed and supportive environment. Some states, such as California, have mandated laws requiring suicide prevention training because of the substantial impact it has had on student outcomes. Additionally, investing in school nurses results in both health and financial benefits for families and school districts. Legal implications of suicide risk intervention. One of the most challenging aspects of suicide risk assessment is maintaining student safety with privacy and confidentiality. Students may be reluctant to come forward if they believe their information will be shared widely or handled insensitively. School nurses must navigate ethical and legal expectations while still making sure students at risk receive help quickly. Protecting student safety and trust demands strict confidentiality, accurate documentation, and communicating only with the administration who need to know. These considerations highlight how complex but essential suicide prevention is for school nurses. Barriers to suicide prevention. Many obstacles can interfere with successful suicide prevention tactics. Some schools have a shortage in mental health providers or limited access to outside resources, especially in low income or rural settings. Stigma also significantly impacts suicide prevention. Students may feel ashamed or afraid to discuss the topic of mental health. A lack of understanding among school staff, as well as cultural and racial factors, can delay early intervention. Understanding these barriers assists school nurses in advocating for more equitable and accessible mental health care. Many factors are implicated in the disparities in suicide care and outcomes for minoritized groups, including racism, bias, discrimination, trauma exposure, poverty, disparities in access to care, and others. Students' perception and understanding of suicide. Students often develop myths about suicide as a result of the absence of mental health education in schools. Many teens view suicide through a lens of shame or weakness, which prevents open conversations. Increased stigma among certain groups, such as adolescent males or students with limited exposure to mental health knowledge, complicates asking for support. School nurses are pivotal in reframing this narrative by encouraging a culture where mental health can be openly discussed. Research on mental health stigma and literacy in young people has tended to focus on depression, anxiety, and psychosis. With higher mental health stigma associated with male gender, younger age, speaking a language other than English, having no personal or family history of mental health illness, and lower levels of mastery and literacy. To sum up, school nurses are cardinal leaders in suicide prevention because they combine clinical expertise with routine contact with students. According to SEEM 2024, suicide prevention screening tools are effective in identifying students who are at higher risk of suicidal ideation in the youth age group, affirming the need for risk assessments for adolescent age students as well. Their leadership promotes early detection, stronger collaboration with faculty, and increased consciousness among students. Investing in crisis training and support for school nurses yields measurable improvements in students' overall well-being and safety. Enhancing the school nurse's role ultimately reinforces the entire system that protects the youth, thus transforming the future of suicide prevention.